The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives. We are looking at children's health challenges from a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. And today, I'm actually the guest on this show, and thankfully, I have a superstar. Welcome, Polly. You're going to take it away and ask me tough questions, I predict.
Well, good morning, Dr. Thomas. Basically, yes. Now, last time we were together, we had some questions from the unvaccinated community. And since then, we've had more coming in. I love that the unvaccinated community feel they have a pediatrician that they can actually speak to without being screamed at. First question coming up is my 3-year-old is unvaccinated and showing signs of ADD, I think. Can I just say before you answer that?
Yes.
Aren't all 3-year-olds a little bit ADD?
Especially the boys. So let me preface this by saying that I don't give medical advice nor diagnose. We are just going to give information that you can then use, take it back to your trusted healthcare provider and figure out a plan. I love this question. And Polly, your comment is great. 2- and 3-year-olds, especially active boys, look very ADHD, right? I mean, they're onto one thing and then the next. They're usually running back and forth. I just spent a few days with my 2-year-old grandson, and yeah, if he was 5 or 6, you would have to diagnose him with ADHD. So let me talk about this whole issue of vaxxed versus unvaxxed and what did we find? So I did that study, right, and published it, and we found something very interesting. 0 ADHD in the unvaxxed. Now, that said, and there was quite a bit of ADHD in the vaccinated, we know it's hitting about at least 10% of boys and maybe more. I think it is absolutely possible to have ADHD or ADD in an unvaxxed child. It's generally not as severe. So when a child is showing signs of ADD or ADHD, they are probably very active. Maybe they're a little short on their attention span. They move from one thing to the next, squirrel, and they're often running. So your question, when to worry and what can be done? I wouldn't use worry as the right word, but have concern because there are things you can do. And this is important. This is true for all developmental and neurological issues that you might be wondering about. Say you've got an unvaxxed child and you're worried about anxiety, you're worried about depression, you're worried about, ADD, ADHD, or developmental delays. What can we do? Based on all the data I have and data from many other studies, and a lot of this is written up in my new book, Vax Facts, the worst thing you could do is to start vaccinating because we all have different genetic vulnerabilities. Some of you have heard of the MTHFR. That's just one out of hundreds, honestly. And so you can have so many vulnerabilities that even an unvaxxed child, because we live in such a toxic world, unfortunately, the air we breathe has toxins. The food we eat, even if you're going organic, which I highly recommend, the organic label is not perfect. So you're still getting exposed to pesticides, things they're spraying on your food. The water, you can't trust municipal waters. Yes, they're better than a lot of places in the world, but they're loaded with toxins and chlorine, etc., fluoride and still in many places. So number one is avoiding toxins. So we're not putting more toxins in the body because in time, that hyperactive 2 or 3-year-old may reach school age and not be ADHD at all. I mean, they may still be an active child. Some of us are wired that way, but you don't want to add to the burden. And it's the toxic burden that's the biggest problem. The biggest toxic load of all are the vaccines. So watch what you're feeding your kid. We need to supplement all our children with vitamin D3 plus K2. And I say that because there are plenty of studies that show that we are actually all running around with insufficient levels of vitamin D3. We don't get a lot of sunshine anymore. The dermatologists have convinced people that the sun is evil, stay out of it, you'll get skin cancer, when the data is actually quite different. Most of the time, the data shows that sunshine, as long as you're not burning, is actually good for you. So get out in the sun. Don't use sunscreen unless you need to avoid burning. and obviously limited. I'm not saying just live in the sun the whole day, in moderation. But vitamin D is made when sunlight hits our skin. That's how our body makes the active form of vitamin D3. And if you're not getting sunlight exposure, which most of us are not, we wear clothes when we're outside, then we are vitamin D3 deficient. And you need K2 with it because vitamin D3 is actually a hormone, but it will also help you absorb more calcium. Too much calcium rambling around in your blood vessels is not healthy for you. So that's where the K2 comes in. It processes your calcium to be stored in your bones where you want it. So those are a few things: eating right, drinking right, avoiding toxins, don't vaccinate, take vitamin D3. And one other really important point. This one I should have put at the top of the list, right below vaccines, and that's screen time. The whole modern system of screens, whether they're games for kids, whether it's social media, whatever, is designed on purpose to captivate you, right? And when you do this to a little child, you are teaching them to get dopamine hits, almost like an addiction. And you see this in so many children and young adults, even adults. People are becoming addicted to their screens, and you need massive stimulation. Once your dopamine gets depleted, now you need more and more stimulation to get that dopamine hit. And that is probably right up there with avoiding vaccines. The single most important thing you can do is get your kids off of screens, have them playing in the dirt with blocks outside, whatever.
The other thing I wanted to mention, you were talking about toxins. I see so many young mums these days also bathing their children in toxic chemicals like bubble baths because it's Sesame Street or whatever it is, bubble bath, and it's full of like poison. So that also, I think people need to look at the products they're putting on their children as well and bathing them in. What do you think?
Absolutely. Thank you for bringing that up. Uh, the skin is like our largest organ in the body and massive surface area that in kids, that ratio of surface area to body mass is even greater. So the skin absorbs toxins, whatever is put on the skin, there's to some degree will be absorbed. I mean, they've perfected this with the pharmaceutical industry putting topicals, pharmaceutical agents in patches and on skin and creams and lotions, etc. But absolutely, you need to do a home makeover, especially if you're wanting to be vigilant about toxins, because those things you put on your skin can absolutely make a huge difference. Thanks for reminding me, Polly.
That's okay. And just again, ADD, attention deficit disorder, this person's asking about. Again, they're 3 years old.
Yeah, I never diagnosed ADD that young, because, as you put it at the onset of our discussion, aren't all 3-year-olds ADD looking? And yes, most are. They will learn to calm, provided they don't get massive overstimulation with screens, for example, and you do a good job with avoiding toxins. They should calm down and be able to then focus better. But there's nothing that destroys focus more than screens. So really be attentive to this, and don't give your young children phones and iPads and unlimited access to screens. It is really bad for their development.
Yeah, and parents, that goes for you as well. If your children are watching you and you're addicted, which I know to a degree, I guess we all are in this day and age, but I see so many mothers just on their phone, walking strollers down the road, and they're just on their phone. They're not even looking at their children. I'm not criticizing, I get it, everybody, but I just feel like they learn from us.
Yes. No, that is a very good point. Do as I say, not as I do doesn't work. Kids
Right.
do exactly what you do. They are looking at us at all times. It's so sad to go into a restaurant and see a family of four with all four of them on their phones. They're sitting at a table in a restaurant and they're not communicating with each other. They're interacting with their phones. Who's raising your child if you're letting the phone be their major source of information and input? It's a horrible thought to think about.
Yeah, and the tantrums that you see when the parents try and take them away, like this is another level. When I had children, we didn't have any of this. I can't imagine what that's like in this day and age. A lot of people are asking about this. What do we recommend for coughs in babies and young children? So clearly we've got whooping cough going around. We've got coughs and colds anyway that are always
Yes.
out there. And people don't want to use Tylenol,
Don't
clearly.
use Tylenol
At
ever.
what point do they actually even need anything? I don't know.
Right. So I think the most important thing with a cough in a child is we want to think about what's causing it. Okay, because some things, you mentioned whooping cough, that can be serious in a young child. Back when I was in practice a few years ago, every winter, we're at that time right now of the year where so many kids are coming down with bad colds, coughs, flu, COVID, RSV, whooping cough. I mean, all that stuff, right? In fact, I've heard right now from people I know who are practicing still that this has been a bad winter. A lot of people are having a lot of cold, cough, flu, COVID, RSV, you name it. So, what to do? Number one, especially if you have a young child, infant, for example, or under age 2 or 3, understand that we don't want them to be going without oxygen. And so, how do you know? Well, during COVID, pulse ox, which is a little thing you can put on your finger, you can buy it for like 20, $30, and it'll tell you how your oxygen is. In pediatrics, in young children, it's important. Now, with COVID, it was misused. And if your oxygen got below 90, you ended up in the hospital and put on those hospital protocols. It ended up being a disaster. So people have fear of pulse ox. But for a young child who has a bad cough and who's breathing fast, you need to know where their oxygen level is, because there's something called the oxygen dissociation curve, and it's too complex to describe verbally without some visuals. But bottom line is, if your baby is breathing about 60 breaths per minute, that's 1 per second. 1,000, 2, 1,000, you can count it. If they're breathing at that level, they are borderline reaching a area on that oxygen dissociation curve where they could be in actual trouble medically. I mean, the first thing you'll notice besides the rapid breathing is then they get anxious, and then maybe they can't feed anymore. So those are some other things you can look at. But if your oxygen level is below 90 and you have a young child, infant, or less than 2 or 3, they need to be evaluated. This would be an indication that they're in trouble. And the major support, the beautiful thing about kids is they don't die from respiratory diseases if you support them adequately. And generally, even if it was pertussis or if it was bad RSV, respiratory syncytial virus, they might need oxygen. And you probably don't have the means of giving oxygen at home. If you do, and you have a pulse ox and you have a provider that's guiding you through that process, that's okay. But don't try to do that alone if they're in trouble. The other thing is, at the height of the respiratory illness season, sort of take December through March, when I was practicing in a busy pediatric practice, I would try to figure out what was causing this particular child's bad cough. Now, if this is a mild cough, that's a different thing we'll talk about. But if it's severe, if their oxygen levels are getting in the low 90s, like 91, 92 or less, it's nice to know what it is, because here's the thing. There are over 20, there's probably over 100, but there are over 20 causes of respiratory illness in kids that you can diagnose quickly with a rapid respiratory test. We don't like the way testing was done for COVID. There was a lot of false positives. That's not what I'm talking about. I'm talking about figuring out, is this pertussis? Is this a bacterial infection that occasionally, if you have bacterial pneumonia, that's one of those times where antibiotics might be indicated and could be important. So you try to figure it out. Do you have a provider you can go to who would do proper testing? That I don't know. But if you do, and your child's in trouble, in distress, you try to figure it out. That said, what can you do from home? Number one is hydration. If you're breastfeeding, breastfeed more. You need to stay hydrated, because if those mucus secretions dry up in your throat and in your trachea and bronchial tree, it gets harder and harder to breathe. If you might have pertussis, Suzanne Humphreys has on her website vitamin C protocols that are highly effective for pertussis. I remember back in 2014, I was in practice when we had a big pertussis outbreak that year in the whole country, but in Portland where I was practicing, I had 20 cases of whooping cough, of pertussis in my practice. 15 of them were in fully vaccinated kids. So you can absolutely get whooping cough, and actually you're more likely to get whooping cough if you're vaccinated. So it's not the answer. The answer is a healthy, robust immune system. So again, vitamin C, vitamin D, occasionally you might need vitamin A. Do that under the guidance of a trained professional. But hydrate, hydrate, hydrate. And then there are some natural things one can do for coughs. One thing I might add, that when I was in practice, we did this for the most severe infants who had RSV, who had whooping cough, who had some maybe undiagnosed cause of a bad cough. And that is, it's good to have a nebulizer. You can buy these online, the little portable battery operated ones. In some states, you can buy the plug-in bigger nebulizers. I had a family from Italy. I just love the way they put it. I was asking them, do you have a pulse ox and a nebulizer at home? And they said, oh, yes. No respectable Italian family would raise a child without a pulse ox and a nebulizer. I thought, wow, they're ahead of us in Italy. Parents know that these are tools you want to have. Well, if you had a nebulizer and a pulse ox, first of all, you can figure out if they're in real trouble with those very low oxygens. Secondly, you can nebulize things that will help quell the cough. I mean, just nebulizing saline solution will actually help humidifying the airway. But you can get Argentin 23 or Sovereign Silver. That is the best form of nanoparticle silver, and it will actually knock out RSV, most respiratory viruses, in a dramatic manner. I mean, I had kids who were, RSV positive, severe bronchiolitis, clear up overnight just using nebulized Sovereign Silver or Argentin 23. People like Dr. Peter McCullough, Dr. Brownstein will use a very dilute solution of iodine and nebulize that. If you go that route, you have to dilute it so dilute that it's just light brown. And when you're nebulizing something, whether it's the Sovereign Silver, Argentin 23, or a very dilute light brown solution of iodine, you put about 3 to 5 milliliters in your nebulizer. And if it's a child, you can put a mask if they'll tolerate that, or you just blow it in their face. You can even do that when they're sleeping. These are things that are very helpful. Then there are, as your child gets older, there are lots of little home type remedies that one can use that can help the cough.
Also, just going back to this conversation earlier when we were talking about the pulsometer and stuff like that, the problem with our community, the unvaccinated community now, is they are petrified of going to hospital. I know we've spoken about this before, but this is the line where it becomes dangerous, because I understand why they don't want to take their child, especially an unvaccinated child. We've seen what happened to the measles girls. God knows how many, all the whooping cough babies. The minute they hear you're unvaccinated, there's something weird that goes on. I mean, they vent them and they kill them. So what do we do? I mean, I don't think you've got the answer to this, except for maybe take an army of people in. Lawyers have Mary Holland on speed dial. I don't know.
Well, okay. If you have to go to the hospital, and especially if you're unvaccinated, Polly, the point you bring up is it sadly appears to be true that in many cases you get treated as a second-class citizen. So do not go to the hospital alone. You never leave your baby alone at the hospital ever. So somebody's always with your child. So I do coaching, for example, at kidsfirstforever.com. And as a pediatrician who took care of tens of thousands of sick kids over my career, I usually just can tell if a child's in trouble or not by looking and listening to them, even online. And there are providers who are like this. I mean, I know you've worked with Larry Pilevsky, for example. He's one. Mindset Kids is another one where they can provide some support. And you may have already a provider who would help guide you and only go to the emergency room as a last resort. And that's great. That's what I would do if a loved one of mine or somebody that was consulting with me just for coaching, as long as they understand I'm not diagnosing or treating, I can give you a sense of, you're good. You don't have to rush to the ER. Or maybe I could say, no, if I were in your shoes, I would go, right? You need somebody with a vast experience of dealing with very sick kids to help you with that decision.
What do you think about this? So I was speaking to someone recently who's about to have a baby, and her midwife, is one of us, said to her, if you're having a home birth and if, I don't know, you hemorrhage or something happens to you, the mum, and you have to go to hospital, do not go in the ambulance or go to hospital with your baby. Because this is really important, everybody, the minute you get into hospital, you're admitted with your baby. That baby is also a patient. But if you have to go into hospital, give your newborn baby to your husband or whoever, and to have the husband take in separately, that baby is then not a patient. How fascinating and interesting is that? Because the last thing you want to do is have your baby put in NICU for a load of experiments.
That's a situation that's not that rare where you're having a baby at the hospital, let's say, and it ends up being a rough delivery. I mean, it's emergency C-section. This happens way too often in hospitals. And dad can only be one of two places, right? So like after the baby's born, if either baby or mom are in trouble, and there's only one person with them, which let's just say in this case it's dad, where does he go? Well, you don't leave that baby alone, that's for sure. And so have a contingency plan for such a scenario. I like your strategy. Yeah, you don't need a healthy baby admitted to the hospital because, yeah, there's hospital protocols for everything, and these protocols aren't always in your best interest.
And there's stigma attached to home births as well. You know, people are just like, oh, the crazy home birthers are coming in. We've heard it over and over again. Well, let's get on with another question. Right, this is a good one. I'm about to have my second baby. I'm concerned the older child will bring back sickness from her school. Do you have any suggestions for keeping babies safe?
Yes, I can tell you one thing you don't want to do, and that is you do not want to vaccinate your other child or the caregivers for pertussis, whooping cough. So that is an antiquated idea called cocooning. The concept behind it made sense. We're going to vaccinate the caregivers, the parents, the siblings, so they don't bring whooping cough home to the baby. It turns out, and we have several studies that prove this, that if you're vaccinated for whooping cough, you're more likely to bring whooping cough to the baby than not. And you're more likely to get whooping cough many more times in your life if you're vaccinated than if you're not. So that's something not to do. Do not tell grandma she has to get a vaccine to see your baby. Don't vaccinate your other child. Here's what you need to know, and you can know this with confidence. Yes, it is possible that a child who's in school is going to get sick and bring stuff home. Now, if your child who's in school is highly vaccinated, they are likely to get sick. They're more likely to get sick, and they are more likely to bring something home. And that's just something you'll have to deal with, but understand that your unvaccinated child, whether they're the school age kid or the kid at home who's new baby, they'll do fine. So new babies are born with immunity that's transferred from mom, birth mom, especially if birth mom wasn't highly vaccinated, especially if birth mom is breastfeeding, your baby will probably be just fine. I mean, it's interesting that most of the infants who get in trouble are the ones who aren't breastfed or they're past that 3 to 6 month range because all the natural passively transferred immunity from mom through the umbilical cord to your baby, it gives protection, some level of protection for 3 to 6 months.
My son is back at school. He's unvaccinated. Should I be concerned about other children shedding their vaccines?
I like this question. You know, the parents who are most worried, this is so fascinating to me. It makes no sense, but it's the propaganda that we've been exposed to over and over for so long. Parents of vaccinated children are actually afraid of unvaccinated kids because, oh my gosh, they're going to bring these diseases to school. And I'm thinking, wait a minute, your kid is vaccinated, so supposedly you're good, right? You're thinking that you did that to protect them. So why are you worried about somebody who's unvaccinated? The real truth of the matter is unvaxxed kids rarely get sick. When they do get sick, they get over it quickly. It's less severe. So it is really the unvaxxed kids who provide a shield of protection. They're the ones who provide that herd immunity, if you will. They're the ones who are least likely to get your child sick. You know, the son back at school who's unvaccinated, should you worry about them? I get this question when kids are traveling too, right? We're going to travel here, there, or wherever, and we're not vaccinated. Should we worry? No, because remember, you are least likely to catch whatever, whether it's a vaccine related disease, I mean, in other words, a disease for which there's a vaccine, or the hundreds of diseases for which there are no vaccines. The unvaccinated do much better. If they catch it, it's less severe. It's, they're less likely to catch it as well. So no, you don't need to be worried. Obviously, we stay vigilant, right? Especially at the height of respiratory season. I mean, my preference, if you've got a newborn at home and it's this time of year, I mean, here we are in the peak of respiratory illness.
Right.
I'm not going out in public with my newborn. I mean, you could make a case for homeschooling until you get through the winter, just to not bring these diseases home. But overall, unvaccinated kids do so much better than vaccinated kids. So that's not a reason to be concerned. The shedding issue it's a little tricky. Like I would not want my toddler to be in daycare with COVID vaccinated kids. That I would not want because toddlers, the age that's crawling, right? They're also teething and everything's going in the mouth. So, vaccinated kid over there is perhaps shedding spike protein, COVID, whatever, and they put a toy in their mouth, they drop it. Your kid crawls over, takes that toy, puts it in their mouth, drops it. There are real increased risks of getting infections in daycare. But it's more the highly vaccinated kids who are going to infect your unvaccinated kid. So yeah, keep them home if you can.
Surely people are not still giving their 6-month babies the COVID shot. Surely not.
It's on the schedule for the AAP anyway. CDC thankfully made that switch. Most of your viewers are probably aware of that switch, but thankfully the influenza, COVID-19, Hep A, Hep B, rotavirus, and meningococcal vaccines are no longer recommended routinely for healthy kids. That's a massive improvement. All vaccines should be absolutely parents' choice. This is what we are actually hoping for. This was part of the reason I'm involved in a couple lawsuits, one against the CDC, one against the AAP.
My daughter has hand, foot, and mouth, and now her toenails are coming off. Is this normal?
That is, you prepped me that question was coming. It's a good thing. I never in my career, I've seen thousands of cases of hand, foot, and mouth. I never saw a case of nails being losing your nails, but I researched it, and yes, it is reported. It's something that can happen, and it's interesting. Most hand, foot, and mouth is caused, traditionally at least, by Coxsackie virus. I think it's Coxsackie A16. But there are now several other enteroviruses causing the same thing. And there's this particular one, A71, that is associated with hand, foot, and mouth and this feature of losing your nails. And as I was researching more about it, I mean, there are even cases of death from Coxsackie virus. Why that's happening, why the shift, at this point, I'd only be speculating. I just wonder, now I am speculating, these biolabs that are fiddling around with organisms, they did all their fiddling with coronavirus. Have they switched over to fiddle with Coxsackie? My guess is yes. And the reason I'm saying that is I read several papers just published in the last 2-3 years. They're trying to develop a vaccine for Coxsackie virus. And when I see they're trying to develop a vaccine, it's like, I've seen that over and over again, right? They make the problem and then they create the solution for their problem. At least they think they're creating the solution. It didn't work for COVID. It's not going to work for Coxsackie. These organisms shift, mutate too quickly. You're not going to catch it chasing your tail trying to make a vaccine for it. So yeah, it can be reported. Your child should be fine, but obviously if they have anything very unusual happening, shortness of breath, trouble breathing at all, obviously seek attention right away in that instance.
Absolutely. And just remind everyone, we are not giving out medical advice here. We're just having a little chat. We'll have to come back and do it again. We have more questions for you, but the time's up for the show.
To the parents who are watching and the would-be parents, get your information. This is a great place to get it. Remember, you're in charge, right? And we don't need to be afraid of viruses and bacteria and infections, especially if you have a robust natural immune system, which is far superior to the immunity you can acquire through vaccines. Sometimes you do get some protection with vaccines, but the price is too high. For every vaccine on the childhood schedule, I've got this documented in my book, VaxFacts, you are more likely to die from the vaccine than if you choose not to vaccinate. Thank you, Polly, for taking over my show. I like it because it's much less work for me. I just show up and speak from the heart.
Well, we have more questions. We'll be back again soon doing more.
Sounds good.
Okay, we are live. So tell us your name, please.
My name's Albert Benavides.
And Albert, tell us what you mean by you're the number one
VAERS
orders. What does that even mean?
auditor. Well, I've been following the VAERS database since day one of the vaccine rollout. I've downloaded the database each and every week, weekends and holidays included. And I've created a website called vaersaware.com where I create an interactive dashboard with the VAERS data. So it's a data visualization site, and it's interactive in the sense that you can click on the filters and get all the different graphs to change. You can zoom in or drill into the data based on age, your state location, the vaccine type. So it's the whole VAERS database back to 1990. And I also keep track of all the VAERS reports that have been deleted. So there's been over 32,000 COVID reports that have been deleted. 1,100 of those have been death reports. So apart from having a separate database for just the deletions along with the live data, I also have a third database that captures all the ID numbers that have never been published. And nobody ever really talks about that, but I'd like to talk about that because this points to the possibility and high probability that there are submitted reports that have never ever been published. And I know this, I have more evidence in the sense that I have participated in an audit with Bree Dressen and React 19, a VAERS audit. And she has a group of people there that have submitted their reports and they've never been published. And now they're in a phone tree given a word salad by the VAERS reps that, the reports are in process. And so there's that. There's a nurse in Ohio that she got fired for voluntarily submitting VAERS reports for her patients. She submitted about 80 reports, and she has 9 people that she has not received the reports for. And so she calls and says, "Hey, where's the report? It hasn't been published." So, that's the second piece. And then the third one is my most powerful, and was Robert Kennedy Jr. Himself was at my church at Calvary Community Church, Christian Church in San Jose, California. He was there on June 19th of 2021, where he had said the week before he Zoomed with some VAERS representatives, the claims processors, and collectively the group told Bobby that up to 150,000 reports had disappeared. That was the exact word that he used, that disappeared from their queues, meaning that those reports had never been published. That they weren't all deaths. They were a mixture of everything, deaths and permanent disabilities and emergencies and all that. But so that's a kind of a third anecdotal piece. I've done analysis myself. I've done a lot of analysis for Steve Kirsch. I'm in his backyard here in San Jose. So all of these things have kind of led me to believe that the people entrusted to maintain the system, which is basically the CDC and the FDA, are not acting in our best interests. I believe that they are the ones that are actually manipulating the data to the point that they are not publishing all the reports. That's one. They're purposely throttling the reports. I say throttling I mean that to say a purposeful delay of publishing reports after they receive them. This is the auditor part, Polly. This is the part that comes in. So I keep track of all of that through my dashboards of when they receive it, the report, and then how many days it takes for them to publish the report. And I have thousands of reports, and I'm talking about just death reports, where they have held the report in their possession for well over a year before they actually publish the report to the world and tell us that this person died. I can go back to just a month ago on their last update, because now they give us updates once a month, so they'll be giving us another update here come the next month here. But even there was something like, just for the deaths that they gave us, which nowadays is not a lot of deaths, domestically speaking, the United States is something like 80 deaths that they gave us this last drop. But 20 of them, the person actually died in 2021. And here we are in 2024 just getting the report published. There's That's what I call throttling. There's a purposeful delay, and at face value, that doesn't look like the CDC's doing it because the timestamp says, oh, we received it a week ago or 2 weeks ago, and then here we published it. Granted, I believe that they actually, some of these reports, that they actually manipulate the receive date, the actual timestamp, and that should be sacred. I have proof through metalerts.org, the great Dr. Stephen Rubin and Barbara Lowe Fisher, that database that he keeps track of those types of edits where they actually publish a report and then they keep it, they don't delete the report, but then they go back later and they change the date that they received it. And then some other stuff like they downcode reports. So they publish a report, and then a year later they'll take the box that said that the patient died, the victim died, they'll take that and uncheck it, which means the patient is now not dead. It's the next highest level, back at hospitalization. But you could read the actual summary narrative and it says the patient has expired, the patient's dead. So things like that, they downcode.
So say I had a Moderna and I had a heart condition, so I report it to VERS, someone reports it to VERS, and then what, so it says Polly heart condition,
Yes.
Moderna. Then what if I die? Do they, 2 months later, will they go back and say, okay, sorry, she's actually dead?
No. Thank you for bringing that up. And that is because this is a great point. They tell us 5 times in the CDC guidelines, I call it the standard operating procedures, but they tell us 5 times only initial reports are made public, even though they continue to capture follow-up data. So they're talking about follow-up data after the report has been published. And anybody who files a report, they know you get pinged at intervals like 90, 180, 360 days, like a survey via the email, and you report back. And the survey is asking you, how are you doing? Are you recovered? Are you any better? Are you getting worse? And in there, are you dead? So yes, the answer is no. Only the initial report is made public. But here's the thing, Polly. In the guidelines, that wasn't always the case. They changed that arbitrary rule in January of 2011, which means that prior to January 11, they did update the initial report. So rather than, what they did is they basically appended the initial reports. They added another paragraph to the summary, changed boxes, like I said, or add a box like, oh, you were emergency, now you're hospitalization. Or what happens a lot of times, like the people at React 19, they want their reports to now reflect they're permanently disabled, when their initial report said they were just at the emergency or hospital level. And they get a word salad from the CDC people saying, yeah, we're going to update your data. And technically, yes, that is true, but internally, they do not, will not go back to the public-facing data and update that to reflect that the person is now dead, because there's a couple of people at React 19, some wives in this case, where the husband is now since dead, and she wants the report to reflect that. So it begs the question, Miss Polly, is that if you remember, and I'm sure you remember, that the Harvard Pilgrim study report that was published in late 2010 was late 2010, and then what does the VAERS people go do? A couple months later, in January 2011, they say, hey, only initial reports are made public. So the Harvard Pilgrim people did not have to contend with that type of paradigm shift that we do now. So it begs the question, and I say it all the time, I think you can easily double the amount of dead people we have in the VAERS system with the people that are now since dead that had those initial reports.
What kind of trends have you seen? What would you say is causes the most death? Which vaccination? Which, I beg your pardon.
Yeah.
Which shot causes the most?
While the shot is the COVID-19 shot. It's really tough to determine because I do a lot of lot analysis and then an analysis on the bivalence, because they do differentiate in the VAERS system between the original monovalent and then now basically the Omicron bivalent. It's such a mess in there, because you can tell, one lot report, half of the reports they're saying that it's monovalent, and the other half it's bivalent, and that can't be. It's got to be one or the other. One of the things that I noticed, and Steve Kirsch had a big wow moment too when we did this, because he asked me to go through all of the diagnosis codes or the symptom codes in VAERS and apply the X factor based against the last 5 years against all other vaccines. And what came of it was that we saw all of the fertility symptoms, the menstruation and all of that stuff. Those were the highest codes that were 5 times above normal based on. So it's kind of like the PRR reporting, which I have a dashboard for that too. And you can clearly see in the PRR at the MEDRA codes, what we call the symptom codes. There's 5 classes, and it rolls up to the organ class. And right there at the organ class, you can see that it's the fertility. I mean, we expected, and even my friend Steve Kirsch expected that it would be like myocarditis or the cardiovascular stuff, and it wasn't. It was all the fertility stuff. So
that's actually petrifying.
Scary,
really,
yeah, scary.
All right, and what about the different? Is Moderna the most injurious of them all, or are we? Because that's what we're saying on the back.
Yeah.
More Pfizer injuries, but the death and everything else seems to be mainly coming from Moderna.
Yeah, well, God, they all look horrible. You of course you factor in like how many doses were rolled out, and it's always tough. Thank God for ICANN and Aaron Siri, who's got the FOIA. At least we have the sizes of the domestic doses for Pfizer and Moderna. But with that, it turns out that the most toxic lot in the entire VAERS database are these 2 lots. It's a arm wrestle struggle between and I have as committed to memory 032H20A Moderna that was punted to Puerto Rico. And the thing about this is that it says in the FOIA document that there was only 89,000 doses shipped. So that's the closest we can get to say, well, we don't know how many went into the arms, but based on the manufacturer data, they said they shipped that many, 89,000 doses out all over the world, wherever it may be. It turns out that this particular this particular lot, Puerto Rico has something like 30 deaths on it. And then like 4 other states in the continental United States have like onesie and twosie deaths. So there's, on the entire lot data in VAERS, it's something like 40 deaths, but Puerto Rico has like 32 of those deaths. So, I mean, we talk about hot lots all the time, and we talk about placebo lots, possible placebo.
Do you think that's right? Do you think there's placebo lots?
Yes, but for a different reason. I do not. When I say placebo, I think, well, how do we know? In 10-20 years, let's see, how you're doing, if you're still alive, if you have cancer. I mean, just because you're not dead now, or
right.
There's nothing seemingly wrong, who knows? It's hard for me to think that the pharma cartel is going to waste an opportunity by giving you a placebo lot. So I'll leave that there. But what I do have is Moderna lot numbers that are expired, with an expired expiration date, because I've gone on to the Moderna website and pulled down every single lot in their master list. Don't ask me how I got that list, but it has every expiration date for every Moderna lot. And I have at least 50 lots that have 0 adverse events in VAERS. 0. So it's like, how do you know? That's why I believe in those lots. Those lots aren't even in VAERS, but I have them, and you can verify the expiration date, and it's there, it shows up. So you ask yourself, wait a minute, what happened to this? Is it these placebos? Is it bad inventory? Were these reserved for the VIPs? That's why I say yes. I believe in those types of placebos, but with the hot lots on the other side, what I feel as an HMO claims auditor, I mean, this has been my job, corporate medicine and medical billing owner and all that. Just my spidey senses are telling me, you know what, this pharma cartel or cabal are too sophisticated to spike an entire lot. I believe, and based on the data that I'm seeing, like that Puerto Rico lot, is they have the ability to spike hot vials within a lot. So that's where I'm saying, yeah, I believe in hot lots, but I actually believe in hot vials within a lot, because I don't think they want to give away show all their cards by spiking an entire lot. I mean, that's not sophisticated enough for these guys. So
what about babies? So they 6 months and above, when they started to authorize the shots for babies. I mean, we're not hearing from any parents here on the bus that babies are injured or dead from the COVID shots. Where are they?
That's a good one, because when you query the VAERS database for all kid deaths from 0 to 17, so children, which would cover the babies, you get about 200 deaths, global, foreign and domestic, 200. But Polly, there's actually over 500 deaths, kids in the VAERS database hiding. How are they hiding? Because the age is not populated in the age field. And so if it's not populated in the age field, these deaths go into the unknown age bucket. And it's not till you actually read the summary report that it says, it clearly documented, this is a 3-year-old, this is a 2-year-old death, this is a 13-year-old death. And so that age group, my friend in Luxembourg, who's also loosely connected, connected with Children's Health Defense in Europe, he's done Dr. David Wiseman introduced me to him. Oh, I'm sorry, I forget the name. I'm just blanking,
okay.
but he's done a PhD analysis on the on all the missing ages that I've found properly documented. Polly, currently 30% of all the COVID reports, of the 1.6 million reports, 30% have an unknown age. That means that's 465,000 reports that have an unknown age. The age is not populated. Yet I have found over 350,000 of those reports where the age is properly documented in the summary narrative. So I go in and plug all those ages. You do this dynamic Python probability algorithm and do my little wax on, wax off, and that's how I call it modeling the data. I clean up the data with the ages, with the vaxes. Polly, in all the domestic deaths for the state, it says unknown state. They can't tell us in 2024 what state this death happened in, with the internet, with fax numbers, mailing. I mean, they can't. You would think that they would know, that they could figure out, that they could ping back the submitter, hey, what state did you come from? 32% of all of our domestic deaths, that's 18,000 total deaths, so 32% of that, whatever that number is, 32% have an unknown state. That's ridiculous. That is a horrible job. And when you look at all the other reports that are not death, that number is only 16%. So, which is horrible, 16% of reports that can't tell us what state, but it's like the most scrutinized, highest level, most severe level, which is death, which is the one they're most scrutinized most. You're telling me that it's double the unknown states from 16 to 32? That's like, and the tall tale sign when it has an unknown state is it's also throttled, delayed. So that combination tells me, Polly, that they are doing this on purpose, that they are actively scrubbing out the state from these deleted death reports, I mean, not the deleted death reports, that too, but the published death reports, I believe, it's only my opinion, I can't prove it yet, that the state was there on submission, and then somewhere in making the sausage and before publication, the state got stripped out.
Do you ever fear for your life? Do you ever get, I mean, because what you're doing must be really peeing them off.
No, I don't fear for my life. I am aware, my situation awareness. I do realize what I'm saying is kind of considered, and kind of like that. But and people asked me, do I have a death wish? Trying to scare me. I said, no, I don't have a death wish. What I do have is I have a what's next wish. And what I mean by that is that, my Christianity tells me that we will live forever, that we are just passing through, and in my journey, this is what I was sent to do, is just to do this and tell as many people, and justice will be served. I don't know if I'll be here around to see it, but in a way I will be, because I just said I'm going to last forever. We are all going to pass through and last forever. So no,
so
I'm
tell
not.
everyone where to go again. Where's your site?
VAERSaware.com.
VAERSaware.com. And what do you want everyone to do about? Because everyone will be thinking, well, okay, so how do we stop this? What do we do? What do we do?
Well, stop getting the COVID-19 shot. Me personally, I'm about freedom of choice, but I will want to say I consider myself anti-vax, and I wouldn't recommend my own family get any vaxes. My 18-year-old daughter, not one. We have to just pause everything, and if there's any good ones, too bad. They all got to get paused, because this pharma cartel is like the Terminator and the Silver Surfer. They you blow them, you tear them apart, and the Silver Surfer will just come back together. So we have to somehow stop the manufacturers. But lastly, I'll say with that is that, the 1986 Children's Vaccine Act of 1986, this is supposed to be, the VAERS system is supposed to be an obligation to maintain it by the HHS, by us, by the government. And if they're not doing that, I think somewhere in there, it should be grounds for revamping that thing, like taking away the liability for the manufacturers, and revamping this VAERS. Everybody beats up VAERS, but it's a great system. I feel like people are being held hostage in there. Those reports are being held hostage. Those kids, all the deaths that I see with no age, no state, I feel like they're being held hostage. And let me in on it, and let me maintain it. So when Bobby gets to the presidency, Bobby, hire me, and I'll manage the VAERS system.
All right. Well, listen. Thank you so much. Remember, Children's Health Defence does not endorse any political candidate.
That's right.
I don't have to put that one in there.
That's right.
Take this interview down. But I want to thank you for the work you're doing, and I know our viewers will too. And so we will go and check it out, and we will follow you. And
thank you.
Yeah, we really appreciate you.
Thank you.